go forward just to tell everyone how the next few sessions, this next section is going to be. We're talking about how survivors can care for their mental health. And this is irrespective of whether they have left the relationship or not. Because if you've seen in the previous panel discussion, it's not just the decision you make that easily. So keeping that in mind, I'm going to discuss with Dr. Aishwarya about the different aspects that we can take into consideration, some things about how a person can pick up the pieces and move forward and take the journey of healing forward. To start with, my first question to you would be, what's the first step? Like, they've recognized the violence, assuming that they've left the relationship, what then? Because there is, like you mentioned in the previous panel, that there's so many short-term and long-term implications to being subject to violence. It's really difficult for a person to come to terms with the fact that they've been abused, and also to have to agree that so much has happened to them and this is possibly going to affect them at different paths. So what is it that you as a psychologist could suggest to people?
Yeah. So just one thing to bear in mind, the conversation today around mental health is going to be fairly generic, because with, as Shruti was saying earlier, that each person who experiences trauma or abuse experiences it in different ways. So there needs to be a deep understanding of context individually, for each individual. So the first step, like you said, is to recognize that abuse is happening to you and acknowledge it, And we often come across narratives. I was having a conversation that day, and I heard someone say to them, "Itna sehte hai, ek aur sahi." So it's okay. It's a marriage, or it's just a slap. So it's important to recognize these narratives and say, no, this is not okay. So that's the first step, I would say. The second step, I would say, is try and speak to someone. Not necessarily if you don't feel able or ready or safe enough to ask for help, but just speaking to someone to get validation of what you've been through. I think that's very important. Following that, I would say establish safety for yourself. And it is not possible to start feeling empowered right away. It is, we need to be in a safe space to be able to do that, where at least your basic needs are taken care of. When I say that, I think of Maslow's hierarchy of needs, where your basic needs, your food, shelter, money, where are you going to stay? Where are you going to sleep? Are you going to be out on the roads? So these kind of things need to be planned, and always best to plan before taking any action. So recovery is usually a long process. It's complicated, and like Shruti was saying, it's not complete. The abuse doesn't stop when you leave the relationship. It continues. Then you start with your own self-critical talk, where you're thinking about your self-worth, your self-esteem. You're blaming yourself or wondering, did I do something wrong? Was it not enough? Or could it have been different? So, and there's a lot of shame and stigma attached to it. So it's important to keep that in mind and treating yourself gently. Be patient. It will happen. It takes time. This abuse, if it's happened over 30 years, it's not going to resolve in 2 months. So even therapy is highly crucial, to avoid PTSD, or to even work with PTSD symptoms if they develop. Making meaning of the entire incident or incidents that have happened to you, or what might have been taken from you. The loss, there's also a loss there. And if you have access to a phone or the internet, there are helplines that one can access for professional help. There's teleservices, there's chat therapy. There are a lot of practitioners now offering services online. So these are just some of the immediate steps that one can take to start recovering. It's never going to be, not never, but it's going to be very difficult to do it all on your own. So it's best to do it with someone, someone who can bear witness to the trauma that you've experienced.
Of course. Especially with the fact that you said that it's important to take therapy as the journey that you use to, work with people.
Yeah.
Considering how mental health is so rarely spoken about, especially in the space of domestic violence as well, um, how does somebody take that first step to even approach therapy? Because we know that even otherwise, this is aside from society's views on how a person who's been abused, therapy is highly stigmatized on its own. So to be seen as someone who's going for therapy, in addition to also being seen as someone who's a survivor of violence, what are the complexities in this such sort of situation for a survivor themselves to deal with, or um, just in general, like how do you communicate this information to someone on how therapy is important?
Sorry, can you repeat that last?
I meant how do you
therapy is
communicate?
important?
Yes, especially for someone who's a survivor of violence.
Okay, so I think the one thing to remember is, again, therapy or mental health by itself I don't think will be enough. And as a lot of the speakers were saying, we need multi-agency, maybe multidisciplinary, survivor groups along with therapy. So that's one important thing to remember. And it is, it's important. There are people who will be toying with the idea of, do I stay or do I go? So, when in a situation like that, of course, while offering all the other support and the practical strategies that we have, therapy can be quite useful in helping people make that decision, and just even helping them think through what would be the implications of them staying, what they could do while they decide to stay on, if they choose to stay on, that is, and if they decide to leave, what are they going to be faced with? So it's almost, even they may not be ready to resolve the trauma they've been through, but helping them think through what to expect, even, because sometimes they may not be. And often I get people come to me and they say, well, I don't know what to expect. I was just sent for a chat. And that's okay. That first point of contact is okay, because you take it from there. Then you assess if they're ready to engage, if if they feel safe enough to engage, actually. Does that answer your question?
What are some of the healthy coping strategies that you could suggest for a person who has left a relationship, or because like you mentioned, it is a loss on its own as well, right? Like the end of a relationship. So and there has been a lot of research about how this can increase in other issues like substance related issues for women or other people who've been in situations. Is there, and understandably, the considering all the other situations around the person, there could be a chance that they may slip into any sort of difficulty and be unable to cope, considering how abuse also essentially destroys a person's sense of self as well. So what are some of those kind of issues that you could highlight?
So some of the healthy coping strategies, and this is, it's always a tricky one, because if you're still in that relationship, how can we even begin to care for ourselves when our sense of safety is threatened? So I think the one thing I usually say is, in therapy, we start working with problem solving, empowering the individual, identifying resources, and which people can do for themselves. Identify your own resources or your own support network, engage with those social networks that you might have, been cut off from. In overall, if it's safe, then do maintain these social connections, because they will help keep you grounded, will help with the validation. Secondly, I think it's the safety plan that I mentioned. I think whether it's locking yourself in a room while you phone a friend, or whether you need to just leave, up sticks and leave, whatever it may be, but plan, I would say, have a realistic plan, because the main focus here is keeping yourself safe and minimizing harm where possible. Third, which we often talk about, is self-care. Now, how do we care for our mental health when we are experiencing ongoing trauma? Or self-care in an abusive context can, it might seem pointless or scary, selfish even to some people, especially if there are children involved, or if you have others to care for in that relationship. Or you could just be made to feel that you're not worthy of it. So I think bringing your attention back to self-care, and something as basic as, and I say basic, but I know it may not be for a lot of people, is by making small gradual changes, for your basic needs. Do you get enough sleep, enough rest? Do you eat well? Are you getting some, some sort of a break, and start by doing this, maybe one a day. If it feels too much to do it all, maybe just try and tackle that. I would say. Then there are other things that people can try. If some people find solace in writing, so people can do that. There's art people turn to, anything creative, because that's an outlet for us. And of course, reading. Different people will have, they engage in physical activities, or staying grounded, doing some grounding exercises like your breathing, muscle relaxation, perhaps, watching a program that you like, or engaging in meaningful activity that means something to you, something for yourself, I think.
And when you spoke about the sense of self and all of that, and this is something Anuradha also mentioned in the previous panel, that in the case of domestic abuse, it's someone you trust, it's somebody you had some sort of trust in, and they are the ones who have gone and broken that trust, and they have been the perpetrator of abuse. It does shatter the sense of trust. People, and of course, there's a lot of difficulty going forward and continuing to be intimate with someone, or building that relationship with someone. How does the survivor rebuild all of this? How does the survivor move on and go ahead and look at building more healthy relationships in the future?
So learning to trust again is a big thing when it comes to relationships. And I would say the first step would be to acknowledge the loss that you have had, maybe looking at or learning from that experience, which we all, usually we are caught in a cycle of self-blame and, self-flagellation. So I think once we have processed that, once we have come to terms with it, made our peace, it's, no, you're not to blame. No, you're not at fault. That's when you can start looking at new relationships and going slow, I would say, looking out for red flags, or, engaging with, say, either a professional or a close trusted family member or a friend when you're starting new relationships, just as a comfort zone, a safety zone for you to discuss things if you're in doubt or if you're feeling unsure. And invariably, you will come up with things which sort of set you back, so you might have a lot of self-esteem issues. And I would say alongside therapy, it's a good way to move forward. So not, not isolating yourself, not trying to engage, keep engaging. Whatever little you can do is fine. Even if it's 15 minutes a day, half an hour a day, that's absolutely fine. And perhaps, volunteering, because that's a good way to meet people. Again, doing something that's meaningful. And it's a fairly neutral ground. You're not engaging with anybody at a deep, intimate level. It's, you can, do your bit and come out again. So dipping in and out, regulating yourself while you're doing things, watching out for physical sensations, making sure you're not getting triggered by certain smells or sounds and things like that. So all these are important aspects, which help you. And of course, long-term therapy does help you with rebuilding that sense of trust and your sense of self after having been through such a traumatic experience.
Absolutely. My final question to you is, again, a lot of things, actually, something that should be mentioned as well, that society's reaction of you coming out is almost an extension of the abuse. And it is difficult for a survivor to come out there and go back into the world. Very often, there are people who hear this one statement from people saying that I knew it all along, or that you should have figured it out before. So how does a survivor deal with this hindsight bias? Because they start doubting themselves, saying that, I say wasted all of my years being with the abuser, or say there's a child involved, my child had to go through this because I did not act. What happens then, and how do they really navigate this?
Yeah. So I think it is the most unhelpful thing to say or even think, because there's no predictive test that you could do. There's no saying, okay, your partner's going to turn abusive in X amount of time. So it's important to remember that this is absolutely victim blaming. It encourages the narrative that the victim is responsible for the violence. And again, as Kamlaji also mentioned, it's not just a women's issue. That some good men help out with, these are men's issues equally. And the moment we say it's women's issues, men might tend to tune out. So I think it's important to remember to engage all narratives, And as for hindsight, it's always 2020, isn't it? We become fortune tellers after the incident. So, and we always believe in that rescue fantasy, that, okay, my love will transform the other person and there's hope of redemption. And but it's very confusing. It's not as if the abuser is cruel 24/7. They might have a very charming side to it. So it's very confusing. So the good moments will keep you in the game, and the bad moments is when we question ourselves. So I think just knowing that you are not to blame, be kind to yourself, be patient with yourself. I think these are key in remembering that there was no way you could have seen this coming.
Right, that's a really wonderful note to end on. Thank you so much, Dr. Aishwarya. I hope to everyone,
Thank you.
Really helpful ways to realize that, being kind to yourself is going to take you a long way in healing.